How's it going, guys? Before we get started here, I'm sure some of you who follow me on social media saw that I'm breaking the fourth wall here, that my teleprompter broke. Obviously, if I have 4 pages of content every week for you guys, I'm not going to remember all of it. However, I'm going to have another one shipped to me. I actually have found a way to make it work. I still want to get out content for you guys. I will be on vacation next week, so there might not be a video this next week. However, for this week, here's my 2 cents worth. If we actually cared about science and the dangers of disease in this country, we would have prioritized being more prepared with proper masks and vaccines versus locking down for a single second during COVID. There's 2 big parts to this. A, how lockdowns have hurt us financially and mentally as a nation, and also what we could have done to be more prepared for something like this. Something that we can still do if this happens again in the future. Let's start with the first part. In a YouGov poll done in November of 2020, this was after things had begun to open back up, of course, 64% of Americans would support their state instituting a 1-month lockdown in order to limit the spread of the coronavirus. Even as of this past April, 56% of Americans favor requiring the public wearing masks on planes, trains, buses, and other means of public transportation, including 80% of Democrats. Let me go through why each were complete failures from the start. Firstly, the lockdowns. For context, what I'm about to read has been labeled as, quote, missing context by some people, but it's from Johns Hopkins University, the same people that the media uses for all the COVID data, and I happen to find these studies pretty interesting. Lockdowns in Europe and the United States reduced COVID-19 mortality by 0.2% on average, concluded Steve Hanke, a professor of applied economics at Johns Hopkins, Jonas Herby, a special advisor at the Center for Political Studies in Copenhagen, and Lars Jonung, a professor in economics at Lund University in Sweden. More specifically, they found, quote, shelter-in-place orders reduced mortality from COVID-19 by 2.9% and school closures reduced mortality by 4.4%. However, lockdowns and limited gatherings actually modestly increased mortality 0.6% and 1.6% respectively. Quote, although this appears to be counterintuitive, it could be the result of an asymptomatic infected person being isolated at home, infecting family members with a higher viral load, causing more severe illness. So for the most part, at least in those areas, it seems like that locking down did little to help, or having measures did little to help. But what about masks? Well, this depends on which mask you wear, of course, and that was something that wasn't really stressed until late 2021 or early 2022 when vaccines had already been readily available with booster shots. If we actually wanted to do mask mandates, fine. Then the government should have been more prepared by having KN95 or N95 masks and respirators readily available for the public. But they didn't, and thus the biggest BS culture war in the history of culture wars began in mid-2020, which I don't even want to try to relive. The truth is, at the end of the day, effectiveness of masks vary widely. A 3-layer knitted cotton mask, for example, blocked an average of 26.5% of the particles in the chamber. Even people in the medical field from CIDRAP, in the University of Minnesota, mentioned cloth masks offered minimal to no benefit, and that's the issue. Up until all mask mandates were lifted, cloth masks were the most common type of mask being worn. I haven't done studies on this, but I would not be surprised if they're actually still the most common ones being worn today. The media never cared enough to make this distinction until it was already too late. People like Fauci actually later admitted that they knew about this, but, quote, were concerned about the supply needing to be saved for healthcare workers. Which I get if we don't have enough supply, but I would actually argue that him being honest with the American people would have been a lot better of an option rather than lying and, once again, leading into the culture war. This gets back to my point that we should have had these masks, though, the KN95s and the N95s, in the first place. At least now we have over 400 million of them for the future. Now let's look at businesses, people, and the overall impact that COVID had on them. In California alone, there were 1,776 COVID-19 related violations identified by Cal OSHA. Except this 1776 wasn't about liberty and independence, it was about control and dependence. Yes, if it wasn't bad enough that 200,000 businesses went under during COVID, tens of thousands of businesses across the nation were fined or lost their license for violating COVID regulations. And look, I'm not going to sit here and defend each and every one of them. Some people were legitimately being assholes, such as Kevin Smith of the Liberty Tree Tavern in Texas, who actually banned face masks during the height of COVID in 2020, and other businesses such as a gas station in Kentucky and a flooring store near LA, which had similar policies to the tavern in Texas. But many small businesses were simply doing what they could to try to stay afloat, as the government did little to help them. PPP was a complete and utter disaster, as 77% of the funds went to the richest 20% of Americans. And the sad thing is, some people use this as an argument to why the U.S. shouldn't have stepped in financially at all, which is also, in my opinion, the wrong idea to have. The answer to this is a complicated answer, and a basic UBI wouldn't exactly be the most fair idea, as those who still needed to work wouldn't have necessarily reaped those benefits, or would have made more money than the people who weren't working. And not everyone, plain and simple, makes the same amount of money. Some form of a wage replacement for people where they report their incomes and people get that exact amount of money could have been implemented if we had a competent government, instead of the stupid unemployment credit cards that were given, which showed nothing but complete and utter fraud, at least here in California. And hey, if those who still work get some hazard pay during that time, that would be great too, as many states don't even have mandated sick pay. And for example, staff members at Red Lobster in other states outside of California said that they worked while they were ill during the COVID-19 pandemic due to a lack of sick leave. And man, I love that restaurant a lot, but it looks like I might have to make those cheesy biscuits myself going forward. But once again, many of those businesses shouldn't have been forced to close down, at least not entirely. And another thing is, we could have been far more prepared, as we already had similar diseases such as SARS and MERS occur in the past, which affected roughly 10,700 people combined. Knowing that was an airborne disease and that it could potentially occur again in the future, we as a country should have funded the medical community to help create vaccines for if an airborne illness like this were to occur again. COVID has fortunately made people more aware of the importance of vaccines, and we should continue to develop and research vaccines that can be potentially helpful in the future to other diseases. In addition, we do a horrible job when it comes to access to healthcare in this country. A study by Families USA found that, quote, nationally roughly 1 out of every 3 COVID-19 deaths are linked to health insurance gaps. More than 40% of all COVID-19 infections are associated with health insurance gaps, and by August 31st, 2020, health insurance gaps were linked to an estimated 2.4 million COVID-19 cases and 58,000 COVID-19 deaths. By February 2021, 10.9 million infections and 143,000 deaths may have been associated with health insurance gaps. Similar studies done by Yale and the Proceedings of the National Academy of Sciences USA found that everyone having universal access to healthcare could have saved more than 338,000 lives. Not to mention that multiple patients who lived and died had medical bills topping over $1 million, as some patients stayed for over a month in the hospital having to go through the ICU. Let me make this 100% clear. Nobody in this country should go financially bankrupt for fighting for their life, period. There shouldn't be two sides to that issue. But it wasn't just healthcare in the hospitals. It was the burden on the mental health of this country, too. The Centers for Disease Control and Prevention, the CDC, reported that at least 40% of adults in the United States struggle with anxiety, depression, trauma, and substance use disorders since the beginning of the COVID-19 pandemic. This data revealed that symptoms of anxiety and depression quadrupled in the beginning months of the pandemic. This research also states that certain demographics of people, such as the elderly, unemployed, and those with pre-existing mental health conditions, were at a higher risk for experiencing suicidal thoughts or attempting suicide. At emergency rooms in 38 children's hospitals across the nation, the number of suicide and self-injury cases in the first 3 quarters of 2021 was 47% higher among 5 to 8-year-olds and 182% higher among 9 to 12-year-olds than they were for the same period in 2016. Absolutely heartbreaking. According to statistics compiled by the Children's Hospital Association, it's clear that although COVID was a nasty burden, we could have at least combated it in more ways than one with proper preparation in the science and medical world, a better overall healthcare system, better leaders, that being politicians and medical experts, and a media who actually cared enough to do its job. Unfortunately, since none of that was the case, we now have to live with the impacts of it when it comes to GDP, food, housing, and a various amount of other issues which can also be attributed to corporate greed. At the end of the day, we as a nation need to prepare for any other danger and emergency that can lead to a public health crisis in the future. Stop yelling at each other about stupid culture issues when it comes to masks, and actually come together and unite as one. If we don't, then the next crisis may have a bigger death rate than just 1%. And that's my 2 cents worth. Thank you very much, everybody, for tuning in. Once again, I know this is a little bit untraditional of a way to go about it. I usually have a different way of recording, but I hope you guys enjoy this. And once again, next time around, we will have a little bit better of a production. Hopefully this time you guys were able to notice that I actually have a better microphone for this one. I'd like to give a big thank you to Davis Brandy for that, helping me out on that front. You should definitely check out his Twitter and his YouTube. Also, one other thing in the future, I am going to try to start incorporating graphics. I know a couple of you guys have mentioned that, hey, since I spout out a lot of numbers, which admittedly I do, it would be nice to have some sort of graphics up, at least in the limited front. I'm going to try to start incorporating that for future videos. But once again, thank you guys for tuning in once again to this one. I hope you guys have a wonderful week. Until next time, take care. Peace out.